Hi, my name is Dr. Isaac, and today I want to talk about drugs. Allow me to add some context to that. There's a concept called the 4Ds concept that I find pertinent to our practice with our patients as clinicians. The first D stands for the individual or the patient. The second D stands for the disease. The third D stands for drugs. And the fourth or last D stands for dexterity. My focus today is going to be on the third D, which is drugs. This concept simply summarizes domains of knowledge that the clinician is supposed to have in order for them to administer optimal treatment or care to their patient. Let's go right into it. Drugs. What exactly is the clinician supposed to know about a given drug in order to optimize their care to a particular patient? Number one is the generic name. The generic name is a non-brand name that is internationally recognized, and this we use to identify the particular drug. For example, paracetamol or acetaminophen. Number two is a brand name or trade names. Now these are different or unique names that are used by different companies manufacturing the same drug to uniquely identify their particular products. For example, Tylenol, for example, Panadol, for example, PA12. It is the same active ingredient of drug but given different names by different companies. It's also important to be cognizant of various combined forms of particular drugs. An example is Myospaz, where we have paracetamol being combined with a muscle relaxant like clozoxazone. Number three is the class of the drug. It is important for the clinician to be able to classify a particular drug. For example, paracetamol will be classified as an antipyretic or an analgesic. Number four is the indications of the particular drug. It's important for us to be able to know where the use of this particular drug is acceptable medically. For example, paracetamol can be indicated for mild to moderate pain. Number five is the mechanism of action of a particular drug for a particular indication. In other words, how does the drug bring about its effect in the individual who has taken the drug? And under this, it's important for us to appreciate the onset of action. How long does the drug take to start working from the time when it is administered? And also the duration of action. For how long does the effect of the drug stay on from the time that it is administered? And then number six are contraindications. In other words, when or in what patient is this drug not supposed to be used? And these can be divided into relative and absolute contraindications. Number seven is administration. And under administration of the drug, the clinician needs to appreciate the different physical formulations of a particular drug. For example, syrups, for example, capsules, for example, tablets, or injectable forms of a particular drug. And also the routes of administration. Some drugs can be injected or what we call the IV. Some drugs can be taken by mouth or by swallowing, what we call the oral route. And some drugs have multiple formulations. For example, paracetamol has an injectable form. It also has a form that we can swallow, or the tablet form. It also has a form that we can drink. So these are the different formulations of the drug. The other one under administration is the dosage of the drug. It's important for us to understand or to know the acceptable or safe dose of a particular drug for different individuals, in a child, in an adult, and so forth. And also it's important for us to appreciate the maximum daily dose of a particular drug. Number eight, we need to appreciate what we call the pharmacokinetics of a particular drug. That is the absorption of the drug, the metabolism of the drug, the distribution of the drug, and the excretion or removal of the drug from the body. Number nine, the clinician needs to know the adverse effects or the side effects of a particular drug in order to mitigate them, but also to alert the patient, which will improve the acceptability or the adherence of the patient to the drug. Number 10 are drug-to-drug interactions. When more than one drug is administered at the same time, these drugs may influence their activities, what we call drug-to-drug interactions. So knowledge of drug-to-drug interactions will help the clinician to be able to optimize his or her pharmacotherapy or use of these drugs. Number 11 is toxicity. The clinician needs to have knowledge of the signs and symptoms of overdose of certain drugs, and also knowledge of how to mitigate or to manage these toxicities. For example, the antidotes. With paracetamol as our example, the antidote for paracetamol poisoning is a substance called N-acetylcysteine. And then lastly, or what I called AOB, is information that is also important to our practice. And this can entail things like the pregnancy category of a particular drug, how safe or how acceptable is this drug for use in a pregnant patient. And also specifically for antibiotics, we have what we call the WHO aware classification. So knowledge of this is also important. And then the other that is important under number 12, which is really AOB, is the chemistry of the drug, the structure of the drug and how it relates to the activity of the drug. And then the cost, it appears under AOB, but it's really important. How affordable is this drug for the patient? If it's a drug they have to take for a long time, how sustainable is it? So these are the 12 pieces of information that a clinician needs to have about a drug in order to optimize their use of that drug by improving adherence of the patient to that drug, but also improving the effectiveness of the drug. Thank you.